Hi, welcome to week 8, the discussion about diagnosing children versus adults. My name is Brian. So first we were asked, did I communicate my needs differently as a child than I did as now? Well, as a child, I reacted to situations with more emotion and less control over my impulses. I feel I was less capable of understanding and reasoning about the complex concepts of the situation. But as an adult, I usually have greater emotional and impulsive control, and I'm better able to comprehend and reason about complicated ideas and circumstances. Additionally, I now have more freedom and autonomy, right? So adults and children communicate their needs in different ways, right? Adults, they'll communicate in more verbal and direct ways, whereas a child might communicate in nonverbal or indirect ways. So on a side note, it's important that when adults interact with children, that they be attuned to the nonverbal cues they use to communicate their needs and to try to interpret them accurately. Now, this might involve paying attention to a child's facial expressions, their body languages, or their behaviors, and using these cues to understand what it is the child's trying to communicate. Second part. When you're considering personality disorders with other disorders with typical childhood onset, what factors should be taken into consideration during the diagnosis of children versus adults? So, when diagnosing personality disorders and other disorders with typical childhood origin in children versus adults, there's a number of things I like to keep in mind. One, the ability to self-report. It may be more challenging for children to appropriately self-report their symptoms and experiences, which can make personality disorders like diagnosing more challenging. Two, comorbidity. Comorbid mental health issues are more common in children, which might make a personality disorder diagnosis more difficult. Hansen, in his 2018 work titled Prevalence and Comorbidity in Children Referred to Mental Health Services, said, among children with neurodevelopment disorders, that's personality disorders, 21.7% had more than one. 3. Be aware of the developmental stage. Children's symptoms and behaviors may alter over time because they are still going through physical and cognitive development. As a result, diagnosing personality disorders in children may be more challenging because their symptoms may not be as consistent as those in adults. And then 4. Cultural and societal expectations. Children might also be more influenced by cultural and societal norms, which might change how they express their symptoms. So ultimately, it's crucial to carefully take into account each of these aspects when evaluating personality disorders and other problems in children with normal childhood beginnings. So how does culture influence diagnosis when working with different age groups? When working with different age groups, cultures can have a variety of effects on the diagnosis. For instance, certain cultural ideas and values may influence how people in various age groups experience and describe their symptoms, as well as how they see the function of healthcare and therapy in their life. The kinds of treatment sought out or deemed appropriate for certain age groups may also vary dependent on cultural beliefs. So when making a diagnosis and creating a treatment plan, healthcare professionals must be aware of these cultural variations and take them into consideration to ensure that the diagnosis and treatment are sensitive to the patient's cultural background. This may entail working with interpreters or cultural mediators, obtaining advice from colleagues, or consulting cultural experts. Do biological factors influence an individual's potential for a personality disorder? Yeah. Short answer, yes. Personality disorders can emerge as a result of biological reasons. Blydorn, in his 2019 work titled Stability and Change in Personality Traits Over the Lifespan, explains, unlike traditional personality literature, temperament research has specifically focused on underlying biological substrates. So certain personality disorders may have a genetic component, according to research, and they may also be influenced by anomalies in the brain or chemical imbalances. However, the complexity of personality disorders, which are assumed to be influenced by a confluence of genetic, environmental, and societal variables, must be kept in mind. People with personality disorders frequently go through stressful or traumatic events in their life, and these experiences must potentially play a role in the onset or progression of their illness. Again, my name is Brian, and this is my Week 8 discussion. Thanks for watching.